When considering adding an ancillary service, many doctors may think they have to change their approach to their patients and start to sell the new service. This concern may slow the adoption of new services because, well, after all, doctors didn't go to medical school to learn how to sell. Well, the good news is you don't have to. You merely have to do what you've been doing all along: educate and recommend. To date, when a patient, let's say Mrs. Johnson, comes to your practice, you listen to her concerns, maybe run a test or two, make a diagnosis, and then provide several options for Mrs. Johnson to consider. The options may include a script, a medical script, or it may be physical therapy, maybe a steroid injection, or if severe enough, the option may be surgery. Whatever the diagnosis, there are usually several workable solutions for the patient, and you take the time to explain the options and the benefits of each. You educate the patient. Then the patient will likely have a few questions or concerns, and you answer their questions and concerns. Again, you're educating the patient. Eventually, the patient will decide on what options they think is best and that fits their situation. They'll present that decision as, let's go with option A. Then you, as the doctor, reinforce the thinking and recommend they proceed. Yes, Mrs. Johnson, I think option A would be the best first step. Let's see if that resolves your condition, and if not, we can always try option B. When you provide new ancillary service, you don't need to sell, you just need to add the ancillary option to the list of options that will work for that patient. The ancillary product may be non-invasive, or it may have a lower cost to the patient, may treat the condition faster, or provide a myriad of solutions not available with the insurance-based solutions. This is especially true for patients that have chronic conditions. After all, if the insurance-based model worked all the time, you wouldn't have chronic patients. You'd be able to resolve their issues. So now that you've added the new ancillary service to the list, the patient will again ask questions to gain clarity. Then they will make a decision based on what best fits their situation, and once again they'll present their decision to you to go with option, let's say A. Then you as a doctor reinforce the thinking again and recommend that they proceed. Yes, Mrs. Johnson, I think option A would be the best first step. Let's see if that resolves your condition, and if not, we can always try option B. So you don't need to sell, just do what you've always done. Educate and recommend. I hope this helps you as you consider adding new ancillary services to your practice to better support your patients. If you have any comments or questions, feel free to leave those in the comment section below, or as always, you can DM me. Here's to your continued success. Take care. Bye-bye.